Hello and welcome back to LTC Heroes Live. We are doing LTC Heroes Summit 2022 here in Ohio. Today on the program, I'm joined by Sara Bartel. Sara's an LPN from Foundations Health Solutions. Sara, welcome to the program.
Thank you.
Sara, today is a unique day because Foundations Health brought in some of their ambassadors you were voted to come here by your staff. Tell me a little bit about how you felt when you found out that you were being nominated to come here.
Humbled and very surprised.
Can you tell me a little bit about the stories in the morning and what you all have been hearing about in terms of inspiration and the feedback and what you all went through during COVID?
Our stories are all very similar. Everyone here is very compassionate, empathetic. They do it for a reason, not for a paycheck. The things that have happened during COVID, our stories are all similar. Very trials. Nobody knew what to expect. Yeah. We all been through the same thing, and it kind of bonded us. And everybody seemed to get out tougher on the other side, but it also made our compassion or empathy even better.
One of the reasons I asked you to join me on the podcast today is because the person that you met, you shared your story about what defines you, something about long-term care that has an impact and has a place in your heart. Do you mind sharing that story?
Not at all. I started off my career in psychiatric nursing kind of shorter term. I kind of fell into a job that was long-term, not what I expected. I didn't realize I'd become attached and actually see a part of my family member in each person I took care of. One man in particular, I cared about him. I was really close to his family, but he was very quiet and just didn't say much. I'd gone home from work and I knew that he was passing, and we had changed his code status to do not resuscitate. I'd gone to bed and woke up at like 4 in the morning with a call from my administrator saying, "You need to come to work, please, we're begging you." I said, "Well, sure, what's wrong? Did someone call off? I'll come to work." They said, "No, the family's actually requesting you. They can't handle," I don't want to cry. They can't handle sitting.
We've already cried twice on this program.
They can't handle sitting with him, and they've asked, because they care about you, would you please go and sit with him? So I spent a total of 36 hours with a man that I didn't realize that I had touched so much. I had no idea. So at that point, and that was about 4 years into my career, I knew long-term was my thing. I can make a difference, even if it was just one, even not knowing it. I didn't know that man felt like that about me. Just being who I am made a difference.
Now with hindsight, why do you think that you had such an impact? Is the way you talked to him? Is his lack of contact with other people? Your voice? Who you meant to him?
I have truly the patience of Job. There's nothing that frazzles me. I can get through anything. I've seen a lot of turmoil in my life, and I've turned it into my compassion to help others.
Mm-hmm. I want to go back to this, the moment when you realized you were a lifer.
Yes.
I call it when you realized you knew you were a lifer and you're going to be here. How has long-term care impacted you as a human being? What are the lessons that you take home with you that affect how you are as a neighbor, maybe as a mom or as a partner, as a sister?
That's another emotional thing. I'm a caretaker to everyone in my family, aunts, uncles, dad. I bring them home, I take care of them, I help them pass in a good way. Recently lost my dad.
Sorry.
That's okay. This past October. Being in long-term care, you don't take things for granted. You're okay to share your feelings. It's okay to cry. It's okay to be happy. It's okay to be mad. And by you being the good apple in the bunch, it helps all the other apples turn redder, not rotten. And I'm a firm believer in that. And that's how I live my life.
Wow, that's profound. You're really, really dropping some really strong wisdom. Thank you so much. Sara, I guess I want to ask you about kind of the frontline caregiver. You're a leader. You have a bunch of staff underneath you who do a lot of care. Today in the exercise, I asked you to visualize what a frontline caregiver looks like in terms of values, in terms of what makes them tick and motivates them and wakes them up. What kind of human being did you envision?
A person who wants everybody to succeed at once, all together. Team effort. Like you had said, my dad always told me that growing up, don't ever ask someone to do something that you wouldn't do yourself. And for us as a team to see management and everybody, you have to lift each other up as a whole. You cannot do it by yourself. No matter how smart you are, educated, compassionate. I'm very empathetic. I can't be that way without staff that is like that to support me, like I support them.
And then I asked you to name a person out loud from your staff someone that you were thinking of that's the epitome of what you just described, who did you think about and why?
I thought about one of our aides, Crystal. I couldn't pick myself or the girl who was with me, and I would have picked her too. Crystal was involved in this meeting a couple years ago. She's just always energetic, very happy. The residents love her. Just an honest, upbeat, caring person. And that's who I envision everybody should be like that, really.
You know, we shared a lot of stories about what we learned through, I guess not what we learned, but what we went through during COVID and during pandemic. One of the things I like to learn from individuals like yourself is, what did you learn about yourself? How did you learn that you're strong, or that you need this connection, or that you need to take care of yourself to be able to take care of others? What did you take away from it?
My story was a little bit unique because I was an ADON, I was an infection control nurse, and I was in charge of all education and training for all the changes daily with COVID. In one day, I had a whole unit that got it. We tested all positive. I had worked the night before filling in. Long story short, I learned about myself that I care about my job so much, but I have to remember about the people at home too. I slept at work. I didn't even leave. I worked 24, 48 hours. I would go in the basement, sleep on a cot, and get back up and go. They had my cell phone number. If anything happened, I'd be woken up and go back to the floor. I lost a third of all my staff. The director of nursing was unable to help because she had a prior illness. It was just doing too many things at once. I had to make time for my family too, so I guess what I've learned is I can't be empathetic and compassionate to everybody all at once. I have to try not to spread myself so thin and still care, and it's okay to say no sometimes.
So there's a lot of individuals in there that are proud of Foundations Health Solutions, what it represents. How would you describe to a young 22-year-old who's thinking about getting into long-term care what it's like to work for an organization that brings 130 people to a room for a 2-day retreat to talk about what they can improve and what we're doing well?
Be prepared to be appreciated, because healthcare is not always that way, and this company does appreciate you. So it's comforting, and it makes you want to say to other people, come work with me. It's a nice place to work, you know?
Yeah. Sarah, I want to move into some rapid fire questions to get your impression on some of them. One of the questions, and it's probably my favorite question, is what's something that you've done in the last year that you're extremely proud of?
Working full-time and taking care of my dad.
You got to say goodbye on a positive note.
Yep, he got to be at home with me. And I still worked and didn't miss a day, and I was able to switch a day, and everybody supported me there, and I was met with such empathy at work. It was nice.
The next question, do you have a favorite failure of yours, something that knocked you down and now you're back up?
Yes, it's the reason I became a nurse. I was going to go to school for psychology and a minor in sociology. I had fallen and hurt my knee and didn't have insurance. I was hospitalized, and I thought, this is it, my life's over. I can't go to college. I had everything lined up. I was ready to move, and because of all these medical bills, I can't afford a student loan. And the nurse was so nice to me and was just talked to me every day, not as a patient, but as a person, and that's why I became a nurse. So my failure of not going to school for what I thought was my dream turned into what is my reality, my dream now.
Crazy how that happens.
It is.
My last question as we start to wrap up here, Sarah, is if you could have a gigantic billboard anywhere with anything on it, on the highway with hundreds of thousands of people to see it, what would the billboard say and why?
Oh, goodness. I don't know. Kindness spreads harder than hurt, I think I would say. I'm a firm believer.
Any reason why?
Like I said before, I just really think that everybody focuses so much on that one bad apple. Well, no. That bad apple will turn if you get them around enough good people. I really believe that.
Sarah, thank you so much for joining me on LTC Heroes. It was a privilege and what an honor to be around such cool people like you here.
Thank you.
Thank you so much.
Thanks.